SpoutingOff.com. Now back to Spouting Off with Karen Kataline.
Well, as promised, sorry, I jumped right in over that lovely music. Thank you, Art, for choosing our bumper music. I promised that we would talk about what's happened to the medical community, we like to say these days, medical politics. I've been all over this issue. It's overwhelming to see how patients' Bill of Rights have been ignored. I've covered this a little bit. I mean to cover it more. I found a great guest. His name is Dr. Stephen Soloway. He completed undergraduate studies at Stony Brook University, attended the American University of the Caribbean School of Medicine, Montserrat, British West Indies, and he is author of the book Medical Politics: How to Protect Yourself from Bad Doctors, Insurance Companies, and, oh yes, big government. I added the oh yes. Stephen Soloway, welcome to Spouting Off here on WSMN.
It is my pleasure to be your guest. Thank you so much for having me.
Well, aren't you sweet? I was so excited to have you in a bittersweet kind of way, because I am deeply concerned about what has happened to the medical profession. God forbid you go in for a gallbladder routine surgery. And I hate to say this, you have to be concerned that people will respect your patient Bill of Rights, will respect your right to deny or reject medical treatment, and on it goes. It seems as if our personal liberties are being stomped all over, and you wrote a book about it. What do we need to know about this? And I can't wait to talk about how you think we can protect ourselves.
Good Lord. I don't even need to say too much, because you've summed it up in a nutshell.
No.
You are at
help.
risk. Well, I can give help. That's why, honestly, I say I'm the best at what I do, but part of what I do is fight for patients, because when you come to a doctor's office and you have insurance and the doctor is not allowed to prescribe medication, or the doctor is not allowed to order a test, that's because we have socialized medicine. And what's happening is the government, with the huge overreach that it has on limited money, they've paid off the hospitals, and they've asked the hospitals to buy up all the practices. And what they do is, instead of auditing several 100,000 doctors, they can audit 1,000 hospitals, and they can have backroom deals where they're really not audited that much, and the doctors who just don't comply are fired. And by the way, that might be the doctor that you like the most. You're never allowed to keep your own doctor. It's impossible. You must go to a doctor who's in private practice. You cannot go to a doctor who's employed by a hospital system, because they are an employee. If you're an employee of a hospital, it's not your career, it's your job. If it's not your career, you don't really care as much. And if you look at it as a job, and it's a 9-to-5 job, if the patient is sick between 4:55 and 5:05, and you go off shift at 5 o'clock, you're stuck. And this has really happened. And I've seen this, and it happens over and over again. People come here, they say to me, Doc, I have shoulder pain, and I say to them, okay, well, we'll inject it, or we'll get an x-ray. Oh, no, wait, you have such and such insurance? I'm sorry, we're not allowed. We need a pre-authorization. Well, what do you mean? I paid for my insurance, and you're my doctor, and you wrote the prescription, and now they're asking you to get it pre-authorized? Well, that doesn't make sense. You're right, it doesn't. So then I get on the phone with my compliance officer, the team of lawyers that I work with that all are employed by the practice, along with an accountant here, and it's a big mess. And so if we fight the fight, if we go to the correct doctors, if we put it to the administration, if, like in my book, I put out the home number and address and letters that I've written to the evil villains who are not allowing people to get procedures, and I say things like, well, if you're telling me on a peer-to-peer call that we're not peers and you're denying the coverage, then I'm going to send out your home phone number and address so they can go to you. You can be the treating physician. You can be sued for practicing medicine without a license. And I'm going to go along my merry way and tell the people what they need. And you're going to be the one sitting there saying, I don't know what to tell you. You'll need to talk to somebody else. Well, no, somebody has to be accountable. It's typically in the private world, it's always the CEO, but you can never reach the CEO. You get the underlings who don't know how to talk, and they try to double talk you. They try to piss you off. They try to incite you to get angry. When you get angry, they hang up. They ban you from calling again. They don't give out their phone number. But every year, there's another bill in the mail that says, the rates are going up and this is going up, but the services are going down. Don't worry, the services are going down. It's scary. The Patient's Bill of Rights, if it would have been signed by Bill Clinton, it would have helped a lot of things. If Obama would have kept his nose out of health care, if Lyndon Johnson was never president, and if FDR was never president, we may not have the welfare state, as Archie Bunker would love to call it. And I wish Archie Bunker could come back with a new show and be the actual president and just fix everything, and wouldn't need no welfare state.
Can you just imagine the radical left losing their cookies over all the things you just said, including that you extol the virtues of Archie Bunker because he had
you're right.
He didn't deserve an opinion. He's a racist. He's a racist.
Oh, yeah, that's right. That's right. Everyone's a racist. If you don't agree with a leftist, you're a racist.
That's right.
If you look at a woman sideways and she's a leftist, you're a rapist too. You're everything.
You're everything as long as they don't like what you said, or if you dare to disagree with what they said. I'm going to drill down. Go ahead.
Go ahead. I'm sorry. No. It's your show. I don't want to interrupt.
No. You're the guest, and oh man, I wish I had you for. Already, I want to have you back. So
I'll come whenever you want. I just want to say one thing. Great. I want to say that my book has in it, in the last chapter, a patient guide to fibromyalgia, osteoporosis, vasculitis, rheumatoid arthritis, lupus, and gout, to name a few. So it's not only a political book. There is information for the regular patient on what they should know, and let them pin down their doctor and get the answers to what they're not being told.
Okay. Well, listen, the good news is we have at least 10 more minutes with you. And
good.
So and we will plug that once again, your book, so people can know where to get it. I'm going to drill down though and try to cut to the chase, because there's so many things I've seen that make me have to pick up my jaw up off the floor.
Yep.
What I'm seeing, what I'm hearing is what I'm watching is a reckless disregard for actual life itself and the Hippocratic Oath. And we are seeing that it is not our imagination. We are not paranoid. That in Canada, they're instituting euthanasia for people who are depressed. I've had on many times Scott Shara, whose daughter was basically killed with drugs, and then they said she was DNR when she wasn't. There is a reckless disregard and a cheapening of life, so that when someone goes in, God forbid, they have a car accident and they're taken to a hospital because they're unconscious. Well, I've seen stories where women, I saw one story where a woman said if she did not get out of that hospital, she was convinced they were going to kill her, and she left in the middle of the night. Did you ever in a million years think that you would see that? Now, when
I almost left the hospital in the middle of the night when I was a patient.
And so along with all the other socialized medicine and control, we're also seeing a maliciousness. I mean, it's bad enough incompetent medicine from socialized medicine, but once there's a maliciousness and you watch people forced on ventilators, forced to take remdesivir, which shuts down the kidneys, and then they don't care and they force it anyway. I don't care what you say. There's a maliciousness going on, and a lot of people have written me and called me and whatever and said, what do we do about this? How can I protect myself and my family?
The first thing to understand is what you just described, is the far left establishes protocols. They don't let people think anymore. So, we'll take care of you from birth to death. They'll decide when you die, and they'll decide how you'll die. And it's true. Obama wanted people
Terrifying.
over, say, 70 or 75 not to be able to get dialysis paid for by the government. So that's just one example of euthanizing in the United States. Now, there are so many things wrong with this system. So many things wrong. You hit all of them. I mean, really, you are as expert as I am at this topic, I think.
Well, Doctor, since we have 8 minutes, what I would love for you to do, and I know it's a tall order, is for people who have what I call the curse of awareness about this, and many other things, but about this is particularly critical. What can they do to protect themselves and their families?
Okay. The first thing you need to do is you really have to vet your doctor. You want to make sure your doctor is self-employed. You want to make sure that your doctor has an open referral network where he's not referring only within ethnic groups or within friends or within a particular system. But you want the best doctor. You want to know who the administration is at the hospital or the facility, because if you do have a complaint, you need to hold administration accountable because they own these people generally. But in a private place, there's still going to be administration. If you're in a hospital, you have to know your rights. You have to tell them, no, you don't knock on my door at 4 a.m. when I don't need blood every day. I'm here to rest and recover, or I'm here to get my IV or whatever. A lot of the things that are going on, if they're questioned, the nurses are programmed to simply follow out protocol. Protocol is the worst thing that could happen to man. The protocol has taken away the ability to think. So you, as the patient, you must hold the people accountable and make them think. You have to question them. Why are you doing that? What's the side effect? What's the risk? Can you tell me why you're doing that? And I don't want to hear, well, it's written in the chart that if your pulse hits 40, you get Narcan. Well, wait a minute, my pulse used to be 30. 40 is really good. So you don't want things done just because the bell goes off. And the problem is they're only taught how to document, not how to think. So if you spend your day as a nurse documenting or as a doctor staring at a computer, you need to walk out if you're the patient because they're not hearing you. They're just trying to fill in the dots that they're required to get their paycheck and to satisfy the government because the government is overlooking these check boxes. This is the most important thing. Getting away from protocol, getting away from people who can't think, getting away from people who are isolationists, who join groups out of weakness because their quality is no good, and who are willing to sell their soul to the hospital for a 9-to-5 job. I mean, this is insane. This is how you protect yourself.
It really is.
Or at least this is a tip of the iceberg of how you protect yourself.
Yes.
And also,
and if for some reason you are infirmed in some way or you're unconscious, make sure you have an advocate for you.
Oh, you must. If you don't have an advocate, I mean, look, as a physician who was a patient, I'm supposedly a VIP. I think they tried to kill me 2 or 3 times. I don't know how I got out alive.
My God.
You must have an advocate. You must. The wrong medicines
How did
are
you
given.
escape it? Are you willing to talk about that just a little
Yeah,
bit?
yeah,
You
yeah.
had an advocate?
So the truth of the matter is, so I went into the hospital with cancer, and I had surgery, and I was supposed to be out in 10 days. It was surgery with the intent to cure. And I went in as a well-trained athlete. I swim every day, bike every day, resting pulse 38. Well, the doctor said, man, you're doing great. Take a walk. So I took a walk. I got back in the bed like I was supposed to, and my pulse went from 42 to 40. Now, remember, it's normally 38. The nurse ran in and hit me with Narcan. She ended my life. I flew on the floor. I had psychiatric reactions, PTSD. I had a leak develop. I went through 3 or 4 other surgeries. I had lung surgery. So many things you can't imagine. I was so terrified I didn't eat for 5 days and lost 42 pounds. Now, here it is 5 years later, and I'm on the phone with you, thank God.
Apparently. Thank God.
And by the way, and listen, my manager, my admin, was there at the hospital. They ripped her out of the room with her husband and interrogated her as to what are my drug habits. Drug habits? I was just put under anesthesia. I just woke up and took a walk. But you see, you're always in the wrong. In the eyes of the left, like, I see a lot of patients. So what do? I don't get congratulated. I get the FBI auditing, or I get the OIG auditing, or I get the RAC audits that Obama created, where they take your money and they keep 20% of it, these bounty hunters. So there's so much financial incentive on the left, which is the overreach branch of the government.
We're almost out of time, and I don't think I understand the bounty hunter thing. I don't know if we have enough time to
Okay, bounty hunter means
that,
auditor that keeps 20% of what they get from you.
Keep of money for what?
Oh, for themselves.
What?
Okay, you come to my office, you pay $100. I see too many people.
Yeah.
They say, let's take back 20% of his money. And we're going to keep 20% of the 20%, because that's the law.
Doctor, I'm on your website, and I'm looking here that you see patients. One of the things we've been seeing a lot of, and I'm a little skeptical, is telemedicine, where people are located in a very different area, and yet they see patients around the world.
I don't believe in telemedicine, and I don't do it. I think it might work for psychiatry.
It might what?
It might be great in psychiatry, where you only have to talk and don't have to look at the people. I can't examine somebody on a TV set.
I am glad to hear you say that, because you've got all this on your website, patient forms and so forth. And I'm thinking there's a lot of people who, if you cannot see them face to face, everybody thinks a Zoom meeting is the same as examining a patient.
No, it is not. No, it is
not. Examining.
I've got to look at your eyes. I got to feel your skin. I got to see your fingers, your skin, your ears, your eyes, your nose, your mouth, your hair. Everything's important.
And it really comes down to respect for life. That's what it comes down to. If everybody is relegated to a number, then their life is not important. And those are not the values that America was founded upon. Dr.
Correct.
Stephen Soloway, how do people get your book, and how can they learn more about you?
badmedicinebook.net. badmedicinebook.net. And I just want to mention that the book is not only a political story, but there is patient information on rheumatoid arthritis, lupus, gout, polymyalgia, fibromyalgia, osteoporosis, vasculitis, and many other diseases that you'll see on a regular basis, or you'll get as a patient. By the way, I live on the mantra, everybody's engine light comes on at age 50. You're all going to have to come see somebody, so you must be educated.
We're going to have to leave it there. I got 5 seconds. Thank you, Stephen Soloway, for joining us. It was very enlightening.
Love you. You're the best.
Thank you. My pleasure. We'll have you back.